Lesson 4. Choking. Choking occurs when the airway becomes either partially or completely blocked by a foreign object. Could be food, a small toy, could even be body fluids. Risk factors for choking. Eating while talking or laughing, or eating too fast. Could be some medical conditions, and could be some dental problems as well. Choking is a common cause of injury and death in children younger than 5 years of age. So very young children explore putting things in their mouths, which increase their risk for choking. Children younger than 4 years often lack the skills needed to chew certain types of foods thoroughly. There's many different types of choking hazards as you see on this list here. There's going to be quite a few more on the next list as well. So there are many different objects that you have to be aware of, especially with small kids when it comes to choking. Recognizing choking.
A person who is choking may look panicked, confused, or surprised, or hold the neck with one or both hands. You may hear coughing or high-pitched squeaking noises, or nothing at all. If you are with a person who starts to choke, first, ask the person if he or she is choking, or check to see if an infant is crying. Then, obtain consent to help. If the person can speak or cry or is coughing forcefully, encourage the person to keep coughing. A person who is getting enough air to speak, cry, or cough forcefully is getting enough air to breathe. But be prepared to act if the person's condition changes. If the person is making high-pitched noises or is unable to speak, cry, or cough forcefully, the airway is blocked. Have someone call 911 or the designated emergency number immediately while you begin to give first aid for choking. The person will soon become unresponsive unless the airway is cleared.
Okay, well, what was shown in that video a little bit towards the end were the 5 back blows. So caring for a choking adult child would be 5 back blows and 5 abdominal thrusts. And you continue to do back blows and abdominal thrusts until you get the airway cleared.
Can I help you? After confirming that the person is choking and obtaining consent, give a combination of 5 back blows and 5 abdominal thrusts. First, position yourself to the side and slightly behind the person. Bend the person at the waist so that his upper body is as parallel to the ground as possible. Firmly strike the person between the shoulder blades with the heel of your hand. Give 5 back blows. After the 5th back blow, reposition yourself to stand with one foot in front of the other, placing your front foot in between the person's feet to provide balance and stability. Find his navel with 2 fingers from one hand. With your other hand, make a fist and place the thumb side against the person's stomach, right above your fingers. Cover the fist with your other hand. Give 5 abdominal thrusts, pulling inward and upward. Continue giving sets of 5 back blows and 5 abdominal thrusts until the object is forced out and the person can cough forcefully, speak, or breathe. Or, if the person becomes unresponsive, send someone to call 911 if it has not already been done. Carefully lower the person to a firm, flat surface and immediately begin CPR, starting with compressions if you are trained. For a child, you might need to kneel in order to give effective back blows and abdominal thrusts.
Caring for a choking infant. It's going to be a similar deal, 5 back blows, 5 abdominal thrusts, but now you can use gravity as part of your help since the child is so small.
After confirming that the infant is choking and obtaining consent, give a combination of 5 back blows and 5 chest thrusts. First, place your forearm along the infant's back, cradling the back of her head with your hand. Place your other forearm along the infant's front, supporting her jaw with your thumb and fingers. Do not cover the infant's mouth. Turn the infant over and lower her onto your thigh so she is face down with her head lower than her chest. Give 5 back blows. Firmly strike the infant between the shoulder blades with the heel of your hand. Then, reposition the infant. Place one hand along the infant's back, cradling the back of the infant's head with your hand. Next, turn her over so she is face up with her head lower than her chest. Give 5 chest thrusts. Place 2 fingers in the center of the infant's chest, just below the nipple line. Press down about 1.5 inches, then let the chest return to its normal position. Continue giving sets of 5 back blows and 5 chest thrusts until the object is forced out and the infant can cough forcefully, cry, or breathe, or until she becomes unresponsive.
So putting it all together, you're on a lunch break with several coworkers. One of your coworkers is eating a sandwich and talking animatedly about the concert he attended over the weekend. Suddenly, he gets a panicked look on his face. You ask if he is choking and he cannot answer you. So in this situation, just get consent and tell him you're there to help. You're going to do the 5 back blows, 5 abdominal thrusts. Once you get consent, you start helping out. Obviously, you have some other coworkers there. One of them should be calling 911 right away. And if there happens to be an AED on site and a first aid kit, you should get that as well. In this situation, we're at school, so consent is implied because it's a kid, assuming the guardian is not anywhere near the lunchroom. In this situation, it looks like Dad is there right now. So if you see this situation, tell Dad who you are and you're there to help, get consent, and then you proceed with the 5 abdominal thrusts and 5 back blows.